Thanks for staying with us here in tonight's edition of The Probe. We call it the Love Edition. I'll quickly introduce my guests to you. For tonight, we have the General Secretary of the Ghana Medical Association, Dr. Justice Yangston. I have also the General Secretary of the Ghana Registered Nurses and Midwives Association, David Tinkran. I also have Dennis Edujesi. He's a PRO, Ghana Association of Medical Laboratory Scientists. He's also a consultant medical scientist as well, joining us tonight. We also have Dr. Peter Popelampo. He's head infectious diseases, Department of Medicine, Kolebu Teaching Hospital. He's also a senior lecturer at University of Ghana Medical School and a member of the National COVID-19 Case Management Team. Thank you so much for your time, gentlemen, here on The Probe. It looks like we are still expecting Dr. Justice Yangston to join us, but it's only appropriate that we start with Dr. Peter Popelampo. There are a number of issues that we need to start dealing with in terms of our post-COVID complications. We'll get into it shortly, plus your comments as well that you've started sending in via WhatsApp. You can also leave them on all our social media platforms. We'll pick it up from there. Remember, we're also live on myjoyonline.com. Good evening once again, gentlemen. I didn't hear your voices the first time.
Good evening.
I'm sure happy Valentine's Day is in order. Good evening. How was your Valentine's Day today?
Well, so very well.
Well, I hope you didn't spend it all at the ward.
I will get back to church. I'm actually going to get back to church after this session.
Oh, super.
We decided to have some show just to have the youth around and not to leave them as prey to the day celebration. Okay. So after this, we find ourselves back at church.
That's perfect. So, Dr. Peter, I hope you didn't spend it in the wards, did you?
No, I equally went to church, and we have a program online, which is currently going on. So maybe after this, I'll tune in.
Okay, glad to hear that. How about you, Mr. Tinkran?
Well, good evening, Mifa. Good evening to your viewers and listeners. Well, I went to church in the morning, and I had to rush to Accra. You know, I'm based in Koforidua, so I had to rush to Accra for this program. So it's been cool.
Super. So we'll get into today. The show is dedicated to our frontline health workers. We're celebrating you in the grand style because what you do, we can do, and we appreciate everything that you've done for us as a country, especially with this fight. But Dr. Peter Popelampo, like I said earlier, let's start off with you because there are a number of issues that people have started raising, especially with the post-COVID complications that people are recording. Most of my colleagues who also got infected. Thankfully, I haven't been infected and I don't hope to be. But they've been talking about their experiences after contracting the virus. Please walk us through it. What are we to expect once you contract the virus and we are told that people even die after testing negative? How come?
Well, thank you very much. It's a worry, but I think the public or the people who have been infected need to be educated. This is a viral infection, and for most viruses, not only COVID, there is that tendency to have this kind of post-viral syndrome. Of course, this is a new one. It's a new virus, and so we're yet to know the extent to which it can devastate the individual after its cycle is over. And so we're still gathering the information. But then knowing that that is how the viruses can behave, I think around about the middle of last year, we started encouraging the various units to set up clinics so that patients who have been discharged will be asked to come back for reviews so we can cater for some of these things. And that is what is leading us to begin to find out most of these issues pertaining to this particular virus. And typically, in most of the cases that come, the one main issue that they present has to do with the extreme fatigue and easy fatigability. They just easily get tired after a minimal exertion. Some people are not able to really concentrate or focus, even after their initial ordeal is over. Others find it very difficult to engage in the usual activities that they do. In some people, the cough that they experience seem never to go away, probably leaving some residual itchiness in the throat, etc. Others continue to experience the inability to smell or eat properly. And so they keep lingering on for variable period of time. Everyone has its own issue. Fortunately, it's not everybody. From studies in this particular virus that is done in other places, roughly it's just about 10% of persons who may have some of these things, and some can be really very serious. In fact, like you just said, it ranges from mild and almost unnoticeable symptoms to some people being readmitted because of the complications. And as we all know, and I've heard severally, this comes with lots of morbidity and affecting almost every organ. And so if it leaves behind complications, which are some of the things that lead to the syndrome after. Others you cannot explain how they do happen, but some are attributable to the complications that the disease leaves behind.
Is it that the virus is not completely gone even when you test the negative, or what exactly is it? Because I've been wondering, I'm very curious. Is it that it's done a lot of damage to your system already that is irreparable? What exactly is it?
Yes, for the virus itself, it has a period that it goes through, the natural life of it, but then afterwards, the damage that is left behind. And that's why you can have somebody who is testing negative and yet still has issues. It's because of the damage that is done. In some people, the lungs, there are some areas of fibrosis, and so getting enough oxygen in is limited. In some people, the extreme weakness has to do probably with the post effect on the heart, etc. And so it is not the virus still present. In fact, we could discharge you and bring you to the main ward, and you will not infect anybody. But it is the after effect.
Okay. Well, we'll get more of this. Let me bring in our other guests as well. Let me go to the nurses, since we've heard from the doctors, and then we hear from those who are testing us, whether we have the virus or not. Mr. Tenkranchum, let's talk about your members and your handling of the situation. Would you say that you are overwhelmed? Is it accurate to describe it that way?
Thank you, Emifa. Well, and good evening to my fellow panelists. I think it's a privilege to share this platform with you. I will not say that we are overwhelmed. You know, when the second wave started, as an association, we decided to renew our commitment to the fight of the virus, and that's exactly what we are doing. What I can say that we are a bit challenged, all right, because our members are getting infected, and even the more, because if I can share some few statistics with you as the program surges on, but
it's okay.
I'll say that we are challenged, but we are not overwhelmed.
It's okay. Let's share the figures now. How many of your members have been infected? And sadly, how many of them have passed on or succumbed to the virus?
You know, thank you, Miva. You know, the nurses and midwives, by virtue of our practice and the nature of our job, we are resident healthcare workers, so we bear the brunt of this pandemic. Of course, every other healthcare professional is as important as any other professional, but because we are resident healthcare workers, we stay with the patient the more. And you can reckon that, I mean, the longer you stay with the patient, the more likely it is that you'll be predisposed with the virus. So, I mean, as of last year, up to August of last year, about 840 people have been infected. I mean, 840 of our members have been infected. And unfortunately, we lost 3 of them. But just this year, from January to today, as I speak with you, 789 people have been infected. So I'm saying that the 800 is gone. All of them recovered except the 3. But as I speak with you, just for between December to today, 789 of our members have been infected with 1 death. That tells you that the new wave is having catastrophic effects on even with the healthcare providers. And therefore, the education must percolate, all right, down to the last person so that people will begin to take absolute good care of themselves. Because as I indicated earlier on, we bear the brunt of it.
Interesting. 789 members, one death. That's just between December and January. That's not impressive at all. But let's bring in the testing officers, the laboratory scientists. Mr. Edujesi, what's your situation in terms of testing capacities? We know that we are not testing as much as we used to, but what's the situation with your members? You have everything under control?
Thank you very much, MFA, and very good evening to your cherished listeners, and kudos to medical lab scientists for holding the fort. You will say that handling the pathogen, the virus, at this particular moment is something that, as people are running away through social distancing and all others, just because they only want to get into contact with the virus, you virtually, by virtue of what you are doing, will have to handle it in one way or the other. So I want to say kudos to the lab scientists for holding forth. But let me say, you know, when the pandemic broke, one of the strides that we had made several was on the fact that we needed to expand testing. Rather than limiting it to Noguchi, KCCR as of that time. And I think the police were ahead and had gotten to, I think, some of the veterinary facilities in testing. As we speak now, we can be talking of not less than 20 facilities in Ghana that are conducting PCR testing for COVID-19. And I can say virtually we have in every region a particular facility that is handling testing. So by virtue of that, you tend not to have the samples going to concentrate at particular facility, just like how it had happened in the, if I may say, the first wave or when the pandemic broke. But then the point still holds that most of these facilities that are testing are now using the GeneXpert. You know, we had given the indication that there is a machine that we are using for the TB testing, and if we should get the reagents, we should be able to use it for COVID-19. Lo and behold, I think the powers there be heeded to the call, and we got most of them being put in shape with the reagents in country. So I can say that about 15 to 16 facilities are using the GeneXpert for testing. But then, these GeneXperts are having models that can handle, just say, 4 samples at a time, in addition to tuberculosis. And for that matter, you can't have all the models dedicated to COVID testing. So most of the facilities will end up dealing with only few patients and may still have to refer cases to the bigger facilities for some of the contact tracing and cases that are not urgently on admission. So yes, the cases are being managed now, but still there is pressure in the facilities that are handling the larger contact tracing
and your members testing. And your members, in terms of infections amongst your members, you have those figures?
Yeah, so I think as of September that we were counting like 75. Now we could do 100 for now. And it's something we've sent across, trying to collect that data from our members, especially in the second wave, to be able to have full grasp on what actually is happening and the toll the infection is having on members. But for now, as it stands, we've only lost a member who left behind a 2-month-old baby. And it's so sad that as we speak, and I think along the lines we are going to discuss, some of the disheartening situation is when some promises are made and is not being honored. And you end up, we hope and pray that it doesn't breed that level of apathy in this time that we need a lot of people on hand to help with the testing and identifying cases to manage them promptly.
Of course, we're talking about the ordeal of the health worker, the promises, and of course the failures. And Dr. Yankson, thankfully, has also joined us via Zoom. Dr. Yankson, you're welcome once again, and I've been wishing your colleagues happy Valentine's Day, and to you as well. So let's talk about your association and your members in terms of the handling of COVID-19 and the second wave. Is it under control? What exactly is it for you and your members, you'd say?
Well, good evening, MFI, and good evening to my fellow panelists. In terms of the second wave, what has become clear to us is that we are under a lot more pressure than the previous wave. Reason being that the number of moderately ill people, severe to critically ill people, has increased within the second wave. And that is one major characteristic of the second wave. So you need a lot more time. You need a lot more human resource, as in personnel, to man the various health facilities that are undertaking care of the seriously and critically ill patients. And that is what is actually putting a lot more strain on us. Mind you, for us as doctors, beyond COVID, we also have the non-COVID cases to manage. So as it stands now, the situation is not the best. The good thing about this is that the first wave gave us the opportunity to have some first-hand or real hands-on, approaches, and we were also able to develop our own unique approach to handling the disease within the confines of what we have as a people. So in that regard, I would say we've developed some expertise, practical expertise, by way of what we did during the first wave.
Okay.
And that has also helped us under these circumstances. But by and large, we need as a people to ensure that we don't increase the numbers or we don't add on to the numbers as we are doing now, because we know very well that our healthcare system is not that robust, especially when it comes to care for the severely and critically ill patients. We are basically stretched, and we don't have to lose our guard such that we get a lot more people becoming infected. As we speak, the infection is across board, from kids to adults. Previously, a lot more of the people were adults, but now we have younger folks also getting infected. And it's not something that we should toy with at all. Okay. Let me put it that way.
And you previously, you've been giving us the figures in terms of those of your members that have been infected. You have a latest figure, maybe as of January, as of February. What exactly is the infection rate amongst your members? And hopefully none has succumbed?
Well, throughout the pandemic, from last year till now, unfortunately, we have lost 7 doctors to COVID-19 in the line of duty. And we have over 450 doctors who have also been infected.
Unfortunately so. But thankfully, Dr. Pupulampo is a member of the National COVID-19 Case Management Team. So I'll come to you on this. Let's talk about our case management as a country. What would you say is the status of it in terms of our management of COVID-19? We've heard from the other associations talk about how stretched it is, there are challenges. What would we say about our COVID-19 management as a country, since you are there?
Right, thank you. When it comes to management, just like Dr. Jansen said, we've had some amount of hands-on experience with all the cadres of workers. What is going on right now is the fatigue, because we've been on. And I keep personally telling most people that as soon as this episode is over, probably I may have to just go for a sabbatical. Since the first case landed, I've not rested a day. And that goes across to almost every other health person. So there's fatigue in the system. And you see, when you're working in such a highly infectious area and you are tired and you are always on, the chances that you let down your guard at a point and get infected is very high. Thankfully, that fear which crowded the whole exercise at the beginning is a bit down. So sometimes you maybe see some of the colleagues walk casually to the patients and you'd have to remind them, look, they are patients and you are the carer. So the fatigue that is setting in is what is going to give way, in addition to the highly infectious nature of probably the second variant, that is going to increase the infectivity among the patients, the workers, the healthcare workers. And so it's about time that something is done to increase the morale and encourage them in whatever way we can. I think would thank you so much for dedicating this episode to encourage the staff. When it comes to what it takes to work, more than ever before, just like Dr. Yankson said, we're not having to have more of the very seriously ill. Of course, if in the first wave, the total numbers were less than, let's say, 20,000, and by statistics, the very severe and critical are between 1% to 5%. Now that you have about 10,000 persons infected, your critically ill percentage is going to be more out of the increased numbers that have been increased. And that is what is causing the overwhelming nature, because now almost all the facilities are full. You just have to justify why you have to be in there. And that is an added pressure. And if care is not taken, that's when the death rate will also begin to go up, because once someone is critically ill yet cannot get bed in, and he waits longer in the periphery when he needs certain types of medications or certain types of support, and he's not getting it, by the time he comes in, it is dire, and it's rather unfortunate. And so I think this is the time that managers and whatever resource that is there need to be pumped the more, so we can get over this critical period.
It's interesting to hear that since we recorded the first case, maybe somewhere in March, you have not rested. That's also not good for you, Doc. We all know that. But of course, you're doing this because you need to save lives as well. I'm sure there are some of your colleagues, hearing that you lost colleagues also, I would want to hear your thoughts on that, at least when you hear that you've lost some colleagues in the line of duty as well. What runs through your mind? I'll hear your thoughts on it. But let me bring in the nurses as well, because you work hand in hand with the doctors as well on this matter. In all this, it gets to a point that people still feel that you become negligent also at some point. People still bash you in the line of all this as well. How then do you juggle this? Because you're trying to save lives. It looks like you've seen it all. So whatever happens, happens. Is that really the case? Do we get it right when we feel that you don't feel our pain, even though we come in, you know, distressed and all? Mr. Tenkwai.
Well, I don't think that position is correct. I've told you that ever since the pandemic broke out, we have constantly been at it, trying to break our back and putting ourselves in the arm's way to take good care of the good people of this country. So it would be rather unfortunate for anybody to dare suggest that maybe we are not being sensitive. But of course, as much as we also want to take good care of people, doesn't mean that we must risk our lives unnecessarily. And this is where I come and present some of the challenges that we are confronted with. And I think I have to say this now, that we need to collaborate the more, especially the various clinicians, because what the report I'm receiving right now is not pleasant at all, especially when even nurses test positive to the virus. The way they are managed, all right, is something that we are not comfortable with. And I think that those...
How are they managed? Tell us, give us the details. How are they managed?
Exactly. You know, as I said, that we need to collaborate them more, because if I get infected, all right, and I'm working with Dr. Jansen, the likelihood is there that I can easily infect him. So we need to protect each other, okay, whilst we try to, you know, go through this challenge. I just received some quite disturbing reports from some facilities in Accra I don't want to mention. And I had to intervene last week, all right, even threatening to report the medical superintendent of that facility, where 4 nurses in a particular unit got tested positive. And because they are asymptomatic, they were asked to come to work. All right. I mean, how can we do this to ourselves? So I think that whilst we are coming together as healthcare workers to take care of the healthcare seekers, we must also try to protect ourselves, all right, and be at each other's keeper. So hospital managers must take a cue from some of these things, because the time will come that we are likely to, you know, take a certain course of action that may not be so pleasant, because if I am working with a medical superintendent and I get to realize that he doesn't care about my welfare, then obviously I'll look at other options that are available for me. So what I'm saying is that when our people get tested positive, one, sometimes they are not even informed, and their colleagues are not informed, and they continue to work. Okay, so I think we have to even visit the hospital ourselves. I mean, last week I was at Reach, and I was very happy what I saw, although I wish that those at the front line were having maybe disposable coveralls. Of course, they had PPEs and the rest of it. It's becoming increasingly difficult for government to provide the PPEs. And hospital managers, okay, are also finding it difficult to provide these things that we need. We know what worked for us in the first wave. So I see no reason why we cannot take a cue from what worked for us.
Okay.
And we are doing this to ourselves.
Well, the doctors are here because this is not the first time I'm hearing that people test positive, and because they are asymptomatic, their employers ask them to come to work because they are not showing any signs. Dr. Popolampo and Dr. Yangsing, really, is that the way to go? If you're asymptomatic, is it okay for your employer to ask you to come to work, maybe protected, wearing mask? Is that okay?
Right, thank you very much. In the protocols that we have set, there is the healthcare worker protocol also, and it spells out very clearly that once you are infected, you're supposed to go aside and be quarantined and not come to work. Because what gained you, what do we gain if you continue to work to infect your patients? In fact, we stand to be probably sued for causing harm to our patients. So it is clearly stated that once you are infected, you step aside. No matter how difficult it will be for the facility, you take care of yourself. And well, I'm not too sure about what he's talking about, but in our facility, we care for them. We ensure that they are given, and sometimes even getting back, some of the supervisors demand a note from their clinicians to show that really they are non-infected, and we've done what it takes to ensure that we give them that certificate before they join their colleagues. And so I think this must be enforced in the facilities. We should look after ourselves better.
Okay. Dr. Yangsing, is it okay? Is it that maybe once you cover up properly, maybe you can, because it's not just nurses. I've heard cases elsewhere also where people have tested positive and their employer still insists that, okay, just mask up, make sure you protect yourself. The work has to be done.
Well, MFA, the rules are very simple. As a people, we have agreed to do what is right. And within a pandemic, you need to do what you have to do to control the situation. If you don't do things properly, you run the risk of contaminating everybody in the society. Whether you work in a media house, whether it's a banking or a financial institution, whether it's a school, whether it's a health facility, once you test positive and you are within the window where you can infect others, you ought to be out of the workplace. And that is why Dr. Popolampo mentioned that there is room for quarantine, there is room for isolation, and what have you. It is all part of the protocols, and it will have to be enforced. If you work in parliament and you think that you are above the law, so you will go in even when you are sick or you are infected, you've tested positive, you are within the window where you can spread the disease, and you want to sit with your colleagues in parliament or come into the constituency, it's not right. What is wrong and must be condemned. Anybody who tests positive and is within the window where he or she can infect others or transmit the disease, the protocols or the rules are very simple. You ought to be in quarantine or isolation, depending on whichever terms you want to use. But technically speaking, you have to be out of the mainstream so that you limit the risk of spreading the disease to others. Because there's always an exponential effect. You as an individual, if you don't do the right things, you could get hundreds of thousands of people infected within a certain chain. You remember last year, there was this famous case where a worker in one of the companies in Tema tested positive. He, for whatever reason, ended up at work, and the whole facility, close to 700 people plus, all got infected. So the key thing here is that whether you work in irrespective of wherever you work, the moment you test positive and you are within that window, you have to be out of the workplace. Okay. It is only when you have gone through your treatment and you've been properly discharged that you can go back to the workplace. And for those who have also been exposed, there is also a lay-down protocol for them. They also need to get tested and all that. And within it, there is a portion or a time frame within which some will have to be in isolation whilst these things are happening. So we did not take chances with the ability of one person to spread the disease to thousands of people. Okay. We should not take chances at all.
Okay. Well,
let me just comment slightly on what David said. The truth is that we are all supposed to be each other's keeper. And especially within the health sector, where the risk is really high at the workplace, we all need to ensure that we care for each other. This may be a test case, but we need to resolve same and ensure that same is also not replicated in other facilities. No excuses will be right when it comes to getting people who have clearly tested positive and are also within the window where they can infect others to go back to work. You raise the life of the very healthcare professionals and you raise the life of the patients. Like Dr. Popolampo said, we run the risk of lawsuits and what have you. But the most crucial thing here is that if you don't manage the situation well and you get everybody within that health facility infected, what it means is that that health facility will have to shut down, and then care to COVID and non-COVID patients will also be an issue. So please, whatever it is, I think we'll all go into these issues and resolve them properly.
Okay.
There are some challenges within the system that will have to be addressed when it comes to health professionals and their infection. Today, I spent a greater part of my day at the Guy's Infectious Disease Center. I was in the center, saw patients, saw the workers. We had a lot of interactions, what have you. And to be honest with you, across the country, health professionals are not happy with some aspects of their care, simply because I think in some situations, people are not really aware of the protocols properly, such that we've had situations where even though care is supposed to be free, some health professionals, including doctors, have ended up paying for their own medications, paying for tests that they'll have to run and what have you. Reason is that he works within the system, he's exposed, he has to be tested, there are delays in the system. Sometimes it will take 2 weeks, a week, what have you, to get results. And they are also human. Their family members may have also been exposed one way or the other because these health professionals may have gone home. So out of desperation, they end up also going the commercial way to go and pay to know their status within, let's say, 24 to 48 hours. And then sometimes they are compelled, more or less, to buy their own medication. It is the bureaucratic, arrangements and some of the lapses when it comes to care for the health professional itself. That even goes beyond COVID.
Okay.
That is creating some of these problems. And these are things.
It doesn't sound good to hear that there's not there's no special protocol in place for health workers to be tested.
There are protocols in place, but the thing is that there are different levels of the healthcare arrangements. So, for example, whilst Kolebu is doing tertiary care, a district hospital may be doing secondary to primary care.
But as a health worker, once you need to be tested, there should be a special protocol in place for you. And it brings me to the promises and the failures at this point, because it looks like there are lots of challenges in the system, and let's try and highlight some of them. I'll bring in Dennis Edujesi at this point. Let's start with those who test us. Let's talk about the promises and, of course, the failures. I heard you earlier talk about the challenges you face as a group But there are a number of promises that were made, for instance. Have they been fulfilled?
Yeah, so anyway, thank you. And nice getting back on this. So if we are talking of promises, it's a matter of 50% basic allowance, motivation for contact tracing, testing facilities, sample collection, and these are fundamentally what the government had promised that he was going to give to frontline workers. I must rush to say that at least the tax waiver, the income tax waiver, all health workers admittedly benefited from it. But then ultimately what was given out or promised to frontline workers, largely, if I'm even just spacing out the medlab scientists for contact tracing, way back we started in March. We still have a lot of complaints. Nothing has happened with our people. In fact, the amount that we have heard the president himself promised, I think that was 150 cities or so, which was woefully inadequate. But we thought that, yes, this was just an expression of intent to help and support the dedication that people were giving up. But that was never even paid. It ended up coming to like 75 cities, and at a point, I think it was even 30 cities. But all these reductions and the amounts that were given, I'm yet to see our members who actually benefited from it. Come to the 50% basic allowance. It's also not been paid, even aside the fact that we had indicated that definition that the government was giving to frontline workers was something that we never agreed to. Now, let me use several examples. I've told you we are having just about 18 facilities that are doing COVID-19 testing. Now, if you are saying in line of duty, frontline workers, we are only considering people who are testing. We are considering people who have identified COVID-19 cases in their facilities to consider them and pay them such allowances. There is strong evidence to suggest that you can have the virus in the stool. However, we have not had evidence to say that people can get infections from the stool. But then exposure to the virus is that paramount, and you can't debate about that in a stool sample. I just want to use that as a basic and fundamental test that we all do routinely. People go to the hospital and you have to go and check your stool. And the stool is processed in such a way that I virtually will have very, very, very small distance between the stool I have prepared on the microscope and my nostrils whenever I am to look at the stool. So the exposure right from the time I am preparing the sample I have received from a patient to when I have it under the microscope to look at it is a risk on its own. Come to it, we are still handling tuberculosis testing. The sputum sample, remember the time that we had the peak of the infection in April and May, when we had to resort to using saliva and sputum for COVID-19 testing. So it tells you that the samples that people are working on it routinely are equally exposing them to the virus. And for that matter, we have said, if you want to only locate people who are handling COVID-19 patients, who are handling COVID-19 testing, as a frontline workers that you want to consider because they are having a higher exposure to the infection, then you are not being faithful and right to the people who are actually routinely handling cases. Even aside that, the smaller group that the government actually identified to be the people that they will pay the 50% basic allowance, it's not happened. And
we are getting a number of messages. We're getting this is an audience-based show. We're getting a number of messages from health workers because of Troll. This is dedicated to you tonight. We're getting information also from the UDS that the tax exemptions for some health workers have not been paid for the last 3 months, we are told. But since we're talking about some health workers testing positive and their employers asking them to stay on, at this point, let's activate the phone lines also and bring in some of the health workers, plus your messages that you sent in as well. I have one health worker on the phone joining us. I'm told he's Haruna. Haruna, briefly, you would want to share your experience with us. Do that briefly for us. Haruna, welcome.
Thank you very much. I'm a physician assistant in Obuasi. This is the second time, last year and this year, but unfortunately this year when I'm still in the house, very severe. I have not received any 50%. I was in the house. I spoke with my medical director. She asked me if I can't come to work, I should take my leave and be in isolation with my leave. Having suffered, I didn't travel. I didn't go anywhere. I'm a physician assistant. Dr. Jansen will testify that at the OPD, we, the physician assistants, see more cases and they attend to the bigger cases.
Okay.
But you get infected through these people. I'm not a frontliner. We have only one medical officer in the facility. And if any case comes, mostly we, the physician assistant, that they call to come and see if the person should be allowed, if the person should be quarantined or whatever. And I don't think my name is not part of those frontline workers. I've not received a penny after 2 infections. I'm currently in the house. And when you get the infection, there's no place for you to go. You are in the house with your family, your children, your wife. Please, please.
Okay.
Government should do something about Dr. Jansen. Please, when you are talking, don't talk for the medical officers alone. Talk for the physician assistant too.
Okay.
Dr. Jansen, I'm begging you.
Okay, Haruna, thank you very much for your call tonight. We are indeed grateful. At least we'll pick a few of them as we go along the line. Dr. Jansen, you've been told to speak for the physicians also. But let's bring in Dr. Popolampo on this, hearing the plights of some of your colleagues, for instance, physician assistants, they've been complaining. But I would want to find out, in terms of the exemptions, there were some promises that were made. Since we're talking about the promises and failures, most of it in your interaction, you are the senior level, would you say that most of these promises have been fulfilled?
When you speak to them, usually when you finish your main clinical work, we have periods where we sit down with them to talk about some of these things, and it keeps coming up. It keeps coming up, and people keep complaining. They have still not received a 50%. The insurance bit of it for those who have been infected, names have been sent, and some have been withdrawn. And so there are issues, and that is compounding the degree to which it's not making them very happy. And so delivery is also being hampered. At best, what we can do is to encourage them. At least the government have started, and hold breath for the authorities that the rest would come. But I think it's taking too long, and the earlier that is redeemed, the better it is for everybody, so that we don't break the camel's back.
I have Albert also joining us. Dr. Jansen, I'll come to you since there was a direct, message targeted at you. Unfortunately, I've lost Albert. There are some messages also that I'll go through. But okay, Albert, thank you for joining us, Albert. How are you doing? I'm told you're a nurse. Briefly, tell us your ordeal. What exactly is your concern, Albert?
Yeah, good evening. My concern, I'm calling from Capital South. Hello. Hello.
Albert, we can hear you. Please go on.
Okay, so my concern is about the nurses who are infected. Somewhere last week, a senior colleague of ours was infected, and the condition got critical to the point that we need to refer. So we referred, and at the referral center, she was supposed to buy certain drug treatment. Now, at that point, a person who has cared for people and has gotten infected in line of duty needed to raise an amount of money which was so huge to be able to even save their own life. What is the system doing to people or nurses and doctors who are infected in the line of duty, where they're infected and supposed to raise that amount of money? What is the system doing about it? Where are they going to get the money? Is the system ready to come in to help, or the nurse or the midwife supposed to raise that amount of money? We are talking about 22,000.
Okay.
In what I'm saying, so what is the system doing about such people?
Okay, Albert, your point is very well made. Thank you so much for joining us so that we can allow some of your colleagues also to come in briefly. I think we have another caller on the line. Hello, good evening and welcome. Hello.
Hello.
Okay, good. I have a female on the line. Welcome.
Hello.
Welcome. Thank you very much for your time tonight. So tell us, walk us through briefly what your thoughts are tonight.
Yeah, I'm a midwife.
Okay, great.
In the Western region. I was down with this pandemic, and I'm not a strong.
Oh, no. Hello? Unfortunately, I've just lost her there on the line. Please call me back if you can hear me. Please call us back. Dr. Yangsing, so there was one that was actually targeted at you that it looks like you're only fighting for your doctors and neglecting the rest of them. And we're getting, if we have time, you would hear the kind of experiences that other members will share with us. So I'm sure briefly you want to comment on that, and then we can watch something from Kumasi. We've been visiting some of the hospitals. Briefly, Doc. You have to unmute, Doc. Dr. Yangsing, you have to unmute. Yes.
Yeah, Emefa. Hi. It's good David is also on this program. He knows the kind of work we are doing. The truth is that whatever we do for the entirety of the health profession and the country at large. There has never been a point at which we go out there and say, look, we are segregating, the health force, and then we'll speak or we'll talk about the concerns of only one group. No. Within this pandemic, we as health workers have one collective problem. And that problem is to deal with the pandemic as the soldiers for the land. Within it, we also work as a team. When my nurse is infected, I'm equally at risk. When I'm infected, my laboratory technologist is also at risk. So for us, we don't believe in segregation at this point. Of course, being a doctor, maybe when I say issue a statement by the association, it might look that, oh, this is Ghana Medical Association talk. But we have never said anywhere that it's only doctors. Any release
so Haruna, that's the assurance.
And the entire health force.
Okay.
And when we have meetings with the powers that be, we speak for everybody. Their concerns are very genuine. What it means is that there are clear problems on the ground that ought to be addressed.
Okay.
If you listen to my colleague, you can see that, look, clearly, wherever he's working and the experiences he's gone through, he believes that probably they are not being heard properly. Probably they haven't been, in quote, looked after properly. So once these things are coming up, it is incumbent on us to ensure that holistically we deal with the issues for the entire health force.
Okay, let me quickly bring in Patience at this point. She's been waiting for too long, Doc. Patience, welcome. Hello, Patience.
Yes, hello.
Good to have you, Patience. Please walk us through what it is that your concerns are.
Yeah, I'm a laboratory scientist, and as Dr. Edideshi, my boss, was talking, we, the laboratory personnel, we are more at risk, and it seems like government or the decision makers are not taking us serious. For instance, a patient will come to you. You don't know whether the person is having COVID or not. And you don't have needle to have that social distance with the patient. When you want to take some blood sample, you get very close to the patient before you're able to take. And some will not even wear the nose mask properly. And even if they are wearing, you don't know whether there will be some escape of maybe air around. So we are more at risk. And we do contact tracing for so many months, and not even one city have been given to us. So I think government should come up and then do something about it so that we can all work happily and save lives. Thank you.
Thank you very much, Patience. And you brought me a lot of joy today. I'm a happy woman because at least I've heard from a female on the show tonight. So we're getting ready to wrap up at this point. I see Dr. Pupulampu sharing that big smile. It's good I brought a smile to your face. So we're wrapping up at this point. I'm sure that the powers that be are watching and listening to you as we celebrate health workers. I'm sure I can give all of you maybe 30 seconds so that at least we can speak to them directly on what it is that you want to change in this fight against COVID-19. I'll start with you, David.
Right, thank you, Mefa. Yes, what I want to say is that as far as there's a midwives in this country are concerned, we have renewed our commitment in fighting this pandemic, and we are not going to renege on that responsibility. What we expect from government is to do the needful, provide us the needed logistics so that we can, fight the war that we have. Again, just to add to what Dr. Adejefi said with respect to the promises that were not delivered. I mean, before just after the pandemic broke out, the Minister of Health at the time announced to all of us that there's going to be 10,000 insurance cover for all the frontline workers, or if like all healthcare workers. As I speak, the first midwife who died, the brother is in Melbourne. She calls me, the time difference between Ghana and Australia. Yeah. He calls me at will anytime that the sister hasn't received anything, or if you like, the next of kin or the children of the sister hasn't received anything. So government should look at the insurance package and make sure that it is paid to the deserving nurses and midwives and the rest of the healthcare workers.
Thank you very much, David.
We are prepared to fight for Ghanaians.
Okay, thank you,
David. They should also be very responsible.
Okay, Edwin, we'll come to you quickly. 30 seconds, please. Let it be your 30 seconds.
Thank you very much. So, for the dedication on the part of MedLab scientists, it's never in doubt, right, from the beginning of the pandemic.
Okay.
Just the insurance, I think it needs to be paid. This same guy.
Okay, so you agree with the insurance packages. Thank you. We'll have to leave it here, but I have a special package as well from Cocoa Board to you, and so that you can also share with some of your members as well. This is very small, a token that Cocoa Board has shared with us. Dr. Yangsing has been distributing some today at GA East, but we have more that we can give to you as well. Expect it at your doorstep soon, so that you can at least give it to your members. I'm so grateful that you're able to join us tonight, and we salute you for the work that you're doing, and thank you so much. God bless you. That's all we can say. God bless you and keep you for us, so that you can continue to save lives in Ghana. That's it for tonight's edition of The Probe. I am Meme Papa. Another edition comes your way on Sunday.